At age 29, Brittany Maynard was diagnosed with stage 4 glioblastoma and told by her doctor in California that she only had a few months left to live. After coming to terms with this grim diagnosis, Brittany decided that she's going to move to Oregon, where she could legally end her life prematurely under the Death with Dignity, a law that's enacted in Oregon. And on November 1st, 2014, with a lethal prescription from her doctor, Brittany Maynard ended her life. Um, where she, as many would argue, she did so prematurely, having time left in her life. So the real question is did she make the correct decision? Also, another question is should she have been allowed to make this decision? Should the legislation have even been in place in Oregon in the first place, where she could have the option to end her life, knowing that she has a few months left to live? And another question is that many people ask is what would happen or what could have happened if she waited longer? Could she have spent time with family? Could she have told her family important things, told her friends important things? Also, maybe she would have lived longer. There's lots of instances where people have been able to outlive their diagnosis by many years, or their prognosis, I should say, by many years. So this is the topic we're discussing today is physician-assisted suicide. So the definition of physician-assisted death or physician-aided death or physician-assisted suicide, as we talked about, it's referring to a physician providing a patient who requests aid in dying a prescription that the patient can self-administer to end his or her life. Again, very controversial. There's lots of talk. Is this something that does harm? One of the things we talk about in medical ethics is non-maleficence, doing no harm. It seems that this would be doing harm, ending a patient's life early. Also, is it doing good? Is it alleviating suffering? Is it doing something that is actually going to, I guess, bring about good and do beneficence as we talk about it in the biomedical ethic world? So just an infographic on physician-assisted suicide. It's currently legal in 10 states. It's legal in California, Colorado, Hawaii, Montana, Maine, New Jersey, New Mexico, Oregon, Vermont, and Washington. And in 2021, there were 431 lethal injections administered by 146 doctors. So that's a lot of, I guess that's a lot of physician-assisted suicide that's already happening. And it's also legal in Belgium, Switzerland, Luxembourg, and the Netherlands. So some of the history to see how things have evolved with physician-assisted suicide. So the Hippocratic Oath that was written in 5th century BC. It states, "I will prescribe regimens for the good of my patients, according to my ability and my judgment, and never do harm to anyone. To please no one will I prescribe a deadly drug, nor give advice which may cause death." So clearly, this is something that in 5th century BC it never would have flown, and no one ever would have got behind this because it violates this part of the oath very blatantly. That you won't prescribe a deadly drug in any circumstance. But in modern times, especially in the 1980s with the coming about of the Hemlock Society of San Diego, this is a group that their purpose was to advocate for people with unbearable suffering to have an option to end their suffering. They pushed specifically for broader rights to access euthanasia and physician-assisted suicide. And in 2004, the group transitioned into the group, which is now called Compassion and Choices. And this group continues to pursue its previous goals. So clearly, there's been a lot of evolution with how we view physician-assisted suicide. In some cases, we do now feel that alleviating unbearable suffering um, via lethal dose is going to do good and is going to actually be something that we can support and get behind as a society and in the medical world. And so the current issue, though, something that's going to come about in 2027 is Canada's medical assistance in dying law, which is going to expand in 2027. So it used to be that you'd have to have terminal illness or some type of physical ailment that caused unbearable suffering, but to be eligible for physician-assisted suicide. As of March 17, 2027, Canadian citizens will be eligible for assisted suicide based solely off of mental health conditions. So this is something that's going to expand the eligibility for people that are having suffering via mental health conditions. And this is something that a lot of people will talk about with autonomy. Somebody with extreme mental health conditions, are they in a place where they can make that decision for themselves? And are they in a place where they can really know if they want to end their life prematurely, if they want to keep fighting? So this is something that is a very current issue in physician-assisted suicide specifically. Well, the question is, what do we think about all this? We know, as we talked about, we talked about doing no harm, doing good, making sure that people are capable of making the decision with autonomy. Also, something is justice for these people. Some of these people, they do have extreme suffering that not a lot of us understand. And the question is it something that people have the right to make a decision on if they end their life early or not? And if we don't allow them to, are we violating their justice? So a lot of things to think about with physician-assisted suicide. But here's why we're excited. I hope everybody learned something. I hope that this got you thinking, and I appreciate you listening. Thank you.